Thank you, Chairman, and thank you for letting me speak at today's Economic Opportunities Subcommittee legislative hearing. I'm here to talk about my bill, the Healthcare for Homeless Veterans Act. Well, I was extremely encouraged early this year to see that the numbers of veterans experiencing shelter homelessness decreased across the country by 10% in the latest point in time count. There is more to do to care for our veterans experiencing homelessness. In my district, veterans homelessness is still a prevalent issue. In Riverside County, for example, the number of veterans living on the street in emergency shelters or transitional housing has been increasing since 2018. Between 2019 and 2022, Riverside County saw a 5% increase in veterans living on the street. And this is heartbreaking. We must do more to ensure that veterans who have served and sacrificed for our nation do not wind up without a place to live when they come home. Right now, the VA has several programs to assist veterans who are homeless. They provide payments to organizations who temporarily house veterans, provide grants to veterans on the cusp of homelessness, and help with support services for those in the HUD-VASH program. These programs serve all veteran populations, regardless of discharge status, including veterans with an other than honorable discharge. However, one program that aims to connect homeless veterans with healthcare services in their communities exclude those veterans with an other than honorable discharge. Those veterans are turned away at the door if they go to the VA seeking healthcare resources in their community. This also means that these veterans are unable to attend outreach events aimed to provide resources to homeless and at-risk veterans, such as the VA's Stand Down event, in which VA staff and volunteers provide food, clothing, and health screenings. My bill would close this gap and allow the VA to connect these veterans with healthcare resources in their communities. My bill would also grant them access to attend outreach events such as the Stand Down programs to get help. By expanding eligibility to this group of veterans, we would be providing care for some of our most vulnerable veterans, those who in many cases need our help the most. I'm grateful that the National Coalition for Homeless Veterans and the National Alliance to End Homelessness have endorsed the bill, and I encourage my colleagues on the committee to do so as well. My question, Ms. Hetrick, do you believe that expanding the VA's healthcare outreach services to other than honorable discharge veterans would take resources away from the honorably discharged veterans?
I don't believe that that would take services away from honorably discharged veterans. We feel that all veterans should receive this type of assistance. As we stated in our testimony, we are supportive of this legislation.
Thank you so much. And Ms. Monet, can you please elaborate on how the Healthcare for Homeless Veterans Act would increase access to VA's outreach programs that connect veterans with other than honorable discharges to healthcare in their communities?
Absolutely. So the Healthcare for Homeless Veterans program is truly one of the unsung heroes within VA's toolbox of resources for veterans experiencing homelessness. They offer healthcare, they run the drop-in centers, they fund stand-downs. That's also the program that really looks at coordinated entry and matching veterans to the right housing program that meets their needs. So when you think about the fact that veterans with certain discharge statuses are not allowed to participate in the very basics, like here's how you get connected to programs, it sort of feels like we're just leaving them outside the door and they've got to figure out how to find the side door in or another way, or maybe somebody else will outreach to them if they're lucky. But in certain communities, veterans with other than honorable discharges make up the majority of the people experiencing unsheltered homelessness because there's not a lot of outreach capacity beyond what the VA can offer with the Healthcare for Homeless Veterans program, and that's just not acceptable. So I do appreciate your leadership in introducing this bill and ensuring that all veterans can access as many programs as possible.
Thank you. Can you describe some of the barriers that these veterans experiencing homelessness face by not having access?
Absolutely. I mean, I think outreach is one of the really big things, right? If you don't know what's out there to help you, how can you access services and support, right? And so when you think about the fact that VA's got all of these really great programs, but if nobody's coming to you and telling you about them, or maybe you don't know that they exist and you're out there talking to folks that maybe you're not connecting with, I mean, it really is the difference between cities having unsheltered encampments of people outside with no support and having people moving inside and accessing all of the benefits that our partners at VA and HUD can offer. So
Thank you so much for your work. Thank you all for the great work that you all do. I really appreciate that. You're making a big difference. So with that, I yield back my time.